It's a tent that I bought off of Amazon, so this is something that's very cost effective for people to implement.
This is an unsanctioned overdose prevention site erected in Nanaimo today by Dr. Jess Wilder, an addictions medicine specialist, trying to prove to higher levels of government how much can be done with so little.
The list doesn't end really in terms of what you can do in a simple tent like this.
She and Dr. Ryan Harriott in Victoria have been leading the charge since last November, setting up these pop-up overdose prevention sites across the street from Nanaimo Regional General Hospital and Royal Jubilee in Victoria. They've been calling on the province to set up formal sites at the actual hospitals.
The reality is right now we have the most potent and contaminated unregulated drug supply on the streets that our country has ever seen, and we don't have enough treatment and recovery resources available to people who want them. So people die while waiting for those resources, and we need to be implementing things that we know can keep them alive while they're waiting.
They point out these sites and the ones they want at hospitals do not give out drugs of any kind. They only offer a safe place for users to use while being monitored.
So from November until June, we had upwards of 80 people who accessed the site just for supervised consumption alone. And we had hundreds of people who came to access harm reduction supplies, Narcan kits, drug testing kits.
Wanda LeBlanc is with Mom Stop the Harm. Her 36-year-old son has been battling addiction for years.
I think that harm reduction is the first step towards getting well and healthy. I think without that, my son would probably be dead.
Dr. Wilder says this campaign started 10 months ago and that here on the island Health has been slow to respond. In an email to CHEK News today, Island Health says Royal Jubilee and NRGH have expert teams, including specialized physicians, that work closely with patients who use substances to develop unique and tailored care plans that meet the needs of patients, protect the safety of staff and other patients. But it added that currently there is no new or standalone funding available to health authorities for this type of service expansion.
It's heartbreaking to hear that finances are a barrier to keeping people alive, when we know that governments can respond swiftly and have the ability to respond in droves when we face other public health crises like we did during COVID.